After the age of 30, your body stops producing type 2 collagen. Collagen is what your tendons, ligaments, and the disc are made out of. Those tissues, especially the disc, is supposed to be 92% fluid. Without the collagen matrix, it can't hold the fluid, and that disc becomes kind of leaky, or it dehydrates with time and becomes weak, and the tissues begin to pull apart, and that's what leads to the rupture. It's not typically one traumatic event, although that can happen, but it's rare. And so, because your body doesn't produce that anymore, we have to supplement it, and that's what the glucosamine does. By taking the glucosamine, however, because most of those tissues are not very vascular tissues, the glucosamine just kind of gets generally dispersed throughout the body. It just goes where the blood's flowing. And that's why here at Integrated Wellness, it's just such an important aspect to do an exercise in the area that you want the glucosamine to be delivered to. In your case, it's the low back, and that's why we have you do the low back wobble chair exercises. 6 planes of motion, creating fluid exchange into the disc, bringing the glucosamine in with it. If I had a shoulder injury, I would take my glucosamine and do a shoulder exercise. A neck injury, I would take my glucosamine and do a neck exercise. And that's why the glucosamine is so important, because then over time, with things like spinal disc decompression and other therapies and modalities, we literally can repair some of that damaged tissue, rehydrate the disc, which increases the thickness, and get a great recovery on disc injuries.